back in 1983, I got hoarse, and my choir director suggested it was about time I went to the doctor because it kept on lasting. And so I went to one of the leading ear, nose, and throat doctors in Louisville, and he gave me Septra, which is a sulfa drug. And I completely lost my voice. And from then on, for 29 years, I've had a problem losing my voice. And so I was so delighted when I came to Dr. Chandran. They were really helpful. They didn't push me too much. Found out that I was using the wrong muscles. And you know what they gave me to cure me? It was unbelievable. They gave me a cup of water and said, blow on it. I did it, and before I left the office, my voice was already better. And when I got home, I was able to talk over the phone, which normally would take me maybe 3 months to get my voice ready to talk over the phone. A week later, I went over to Liz Ann's office. Well, I went to her for one visit, and she said, you don't have to come back, but I want you to call me. And so about 2 or 3 weeks later, I called and I said, I want to come and perform for you. And so I did. And that's my story.
I'm a special education teacher. I work with the multiply handicapped, and I'm a mother of 3. I had the flu, and from the flu it went into laryngitis, and then it just kept going. My voice just kept getting worse, and until I had no voice. And it took a while for doctors to be able to give me a good diagnosis, because they had a hard time figuring out what it was. Then I was diagnosed with spasmodic dysphonia and atypical spasmodic dysphonia. And I started with a doctor here in Louisville, but he was not a voice specialist. He was an ENT who did Botox injections. And he was never able to get any good results. So he sent me to a doctor in Chicago. I was treated in Chicago for a while, but with me, my voice will go out with no warning. Then when I got the Botox injection, I didn't get results for maybe 2 weeks to a month. The last time it was 4 months, and that forced me to retire. Then when I had to retire, that was really devastating. I struggled with spasmodic dysphonia for 12 years. And it was really, really difficult. Those were the years that my children really needed me. So came back to Louisville and talked to Liz Ann Craven, and she told me that Louisville now had a voice specialist. So I was real excited to meet Dr. Chandran, and she has been just wonderful. I think one of the big things with Dr. Chandran and Ms. Craven is that they were willing to step outside of the box. And then Dr. Chandran was willing not to do the usual thing of Botox injections, and she decided that I needed to get intensive speech therapy. And Ms. Craven did. We worked for a while, and then they decided that I would do a voice boot camp. So I would go in every day for several hours a day, and it worked. I got my voice back. It's been a miracle. I have recommended other people because I've not seen the type of care that I got with Dr. Chandran and Ms. Craven. Just that they cared so much, they took the time to listen and then to work with me and to come up with a plan.
I work at Starbucks. I'm also a student at the University of Louisville. I'm taking vocal performance there. Well, last semester I went through several periods of hoarseness that we just couldn't explain. A couple of days of rest would typically take care of it. But at the very end of last semester, it was the day of my final exam. And I was trying to warm up, and there was a lot of hoarseness that was just really unexpected. I hadn't had any problems the days before, and then I woke up that morning and I'd lost about half my range. My speaking range was very low. And so I asked my teacher at first to wait a day and to postpone my final exam until the next morning. But she was worried when she heard me talking and told me she wanted me to go see a doctor. So I went to another doctor. Well, he took a look at me and diagnosed a vocal hemorrhage and wanted to see me again in a couple of days after some rest, and he said that if it wasn't any better after those, it was about 3 days, I think, of rest, he wanted to do surgery. It was a cutting on the cord, a microincision is what he called it, to drain blood. Well, it made me very nervous, and I didn't want that to happen. I felt like he was wanting to rush things. We went to see her. She took a picture of my vocal cords, and from what I had remembered a few days before, it looked even worse. And so she decided to prescribe complete rest for about 10 days. I worked with her and Lisanne Craven, and they both talked to me about, even when I did start speaking again, how to do that, how to use my voice so that it would take the most pressure off of my cords. After the holidays, I saw them at the beginning of January again, and unfortunately, it had gotten much worse. We had to go on more rest, no more speaking. In the meantime, the semester started back up at school, and I was no longer able to take voice lessons. In January, whenever I saw Dr. Chandran again, after an extended period of rest, the blood had actually gone down, and it revealed two very enlarged blood vessels on my vocal cords. Basically, what had happened is because they were enlarged, they were a lot more sensitive, and whenever the vocal cords came together, that's what had caused the hemorrhage. And so after talking with Dr. Chandran and with my voice teacher, who had been coming with me to every appointment, we decided that the best option would be surgery. Dr. Chandran recommended a laser procedure, which wouldn't involve any cutting of the vocal cords. Surgery did seem like the best option. We had that surgery on January 31st, and afterwards she said that it was a success. She was very sensitive to the fact that I am a singer and that this is just an important part of my life, and so I really appreciated that. Within a really short amount of time, I would say about 3 weeks, I was able to actually start singing and working on repertoire again. So I was able to finish up my semester, take my final exams this last May, and that's basically what happened. Dr. Chandran was so careful with me. She never wanted to push me further. She never tried to rush me. You know, that first doctor that I went and saw, I was just so overwhelmed by the fact that maybe he wanted surgery right away. And even though I ended up having surgery with Dr. Chandran, I felt like it was timed better. She took much more care with how she went about it, and I really appreciated that.